It is my great pleasure to introduce our first speaker, Chris Tholkes. Said it right. Chris Tholkes brings over 25 years experience working in the public, nonprofit, and philanthropic sectors. She's currently the director of the Office of Medical Cannabis at the Minnesota Department of Health and sits on the board of directors for the Cannabis Regulators Association. Previously, she served as assistant division director for the Office of Statewide Health Improvement Initiatives, which includes the Statewide Health Improvement Partnership, SHIP, tobacco use prevention grants, and tribal grants. Additional experience includes serving as the program officer for Otto Bremer Foundation, a staff lobbyist and senior policy manager for Clearway, Minnesota, and as director of tobacco control for the American Lung Association of Minnesota. She holds a bachelor's in community health education from Minnesota State Moorhead and a master's in public administration from Hamline University. Welcome, Chris. So happy to have you.
All right. Good morning. I am also a morning person, but not as much of a morning person as Paloma. Since it's a small group, I'm curious to know how many of you are you Minnesotans or have you traveled? How many Minnesotans in the room? Okay, great. Oh, all right, everybody. Okay, so let's go ahead and do this overview. Since it's a small group, I'd love if you just go ahead and ask questions as we go along. Just pop your hand up. That would be great. So Minnesota's program is fairly unique. I guess you could say that of all the programs really in the U.S. because if you've seen one program, you've seen one program. A lot of these medical cannabis and the adult use or recreational programs across the U.S. were either passed through ballot initiatives or through legislative means, and that means that because there's no federal guidance, they're all just set up pretty differently. What's interesting, I've been with the Office of Medical Cannabis now since 2019, and it's just ever changing. It's constantly being tweaked every year by the legislature. There's always some new conditions or some new rules or some new kind of trying to open it up as a wider program. But back in 2014 is when Minnesota's program passed, and we started serving patients in 2015. So the first 7 years of the program, it was really a pretty tight program. We were only allowed to offer extracted products. So this means liquids and oils in the form of capsules, tablets, topicals, tinctures, vape cartridges, lozenges, and water-soluble particulates was added fairly recently. As of March 1st of this year, we've added dried raw cannabis, which means that we have flower and pre-rolls available as well, and we're going to talk a little bit more about that later. Another unique component of our program is that we require pharmacist dispensing. So a consultation is required for dosage and product recommendation. We're limited to 2 vertically integrated manufacturers, and vertically integrated just means that they each do everything. So they are cultivators, they do the production of the medication, and then they also are the distribution or supply. They have the dispensaries. In some other states, all of those are separate licensing categories, so you might see one company that's doing the cultivation, another company that's doing production of product, and then independent dispensaries as well. And then we also have a commitment to learning. When I started this program in 2019, I was actually quite surprised, coming from public health, that this isn't a core component of every medical cannabis program across the U.S. We have a commitment to, as you probably know, because of the federal restrictions on marijuana, there is pretty limited research in the cannabis space. A lot of what we have learned about cannabis is learned from product on the illicit market because there are DEA restrictions on what product you can use for research, what kinds of research you can do. And so it's growing, but it is still fairly limited. So we have really committed to, it's mostly self-report data, and I won't say too much more about it because you're going to hear a lot more about it when my colleague speaks. So for qualifying medical conditions in Minnesota, we're up to 17 qualifying medical conditions. You'll see that the The column on the left is the conditions that were added in statute in 2015. And then the conditions on the right that have dates next to them in red, those were all added through our petition process. So we have an annual petition process, which just means that we open up a period of time every summer where anyone can petition us to add another condition. We ask that they answer some questions, fill out a form, tell us about what treatments are available already for that condition, what do they hope to gain from adding cannabis as a potential treatment option or symptom management. And then we do our own research on each of those. So we turn it over to our research team, and they do a full-blown research brief, and they see what's out there, what do we know. Like I said, with the research space being fairly limited, sometimes we can find a clinical trial, but a lot of times we don't. So we try to just build the knowledge from what we know. And then we do a variety of things. We have a petition panel that reviews each of the conditions and that research brief, and they talk through all of the pros and cons of adding the condition. And then we take it to our Commissioner of Health, and she makes the ultimate decision on whether or not we'll add that condition. At the same time, during the petition process, we also open up a petition process for adding new delivery methods. And so it was restricted to say that people could not ask us to add flour. The legislature did end up doing that eventually, but that's how we got lozenges. That's how we got water-soluble particulates, is someone petitioned us to add those as a new delivery method. Although my favorite that we get every year is that sometimes people misunderstand what we mean by delivery method, and we inevitably always get a petition to have US mail as a delivery method. Yeah. So now I'm going to walk through sort of all of the actors in our system, or who can operate in our system. So the patient requirements: you have to be a Minnesota resident with a qualifying medical condition. We don't have a program card. A lot of patients, some states do have an actual card for their program, and that's what you show when you go to the dispensary. Our program doesn't have that. We rely on the bottle, the container that the medication comes in. It has a label on it with the patient name, the contents of the container, and then some other information. So if law enforcement were to question someone, we really rely on them to show them that container that has their name, their date of birth, and then their ID, and they'll be able to match it up and say, you're authorized to have that. We also do not have reciprocity with other jurisdictions. So some states also offer that. They will recognize medical cannabis patients from other states when they're visiting, and Minnesota does not have that option. Interestingly, though, this year in the legislature, there is a bill moving forward. We have 2 tribal nations that have passed medical cannabis programs, White Earth Nation and Red Lake Nation. And there is a bill moving forward that would allow reciprocity with those programs. So it would allow patients who are enrolled in the state medical cannabis program to also purchase from the tribal programs, and vice versa. We'll see if that comes out in the end, but it is still alive for now. Patients must enroll in the registry and agree that the data in the registry can be used for aggregate reports and research, and you're going to learn more about that when David talks. And then we do have an annual enrollment fee, and I'm not proud of this one. $200 is the annual enrollment fee. That is the highest in the nation right now. There's also a bill moving forward this legislative session to drop that to $40 a year for everyone, and we're really hoping that that one makes it through. For those, there are some folks that can pay a reduced fee. It's for some very specific instances, so you can see them listed there. It's SSI, SSD, folks who are on Minnesota Care or medical assistance, things like that. They can pay a reduced fee. And I will say that in our program, it's about 50-50. Half the patients pay the full amount and half the patients pay the reduced fee. And then in 2019, we did a cost study. We heard a lot of anecdotal stories. That is one of the major complaints about a medical cannabis program is the cost of the product. So you not only have to pay your enrollment fee, but medical cannabis is not covered by insurance. And so, yes, we refer to it as medicine, but it's not covered by insurance like other medicines are. And so we really wanted to get a better sense of what are people actually paying. And so we did a cost study, and we learned that the average 30-day supply is $316 a month. And that really varies depending on the individual circumstances and on the condition. So we do on our website have a very thorough report, and people can go ahead and look up their condition and see what the average patient who has that condition is spending, which I think is at least helpful for consumer awareness before they register for the program. So healthcare practitioners. We require that there are 3 categories that can certify patients in our program. Minnesota licensed doctor of medicine, a Minnesota licensed physician assistant, or an advanced practice registered nurse. And I will say about 70% of our HCPs that are certifying are doctors. About 20% of them are APRNs, and only about 10% are physician assistants. And when we've talked to those PAs, they've told us sort of that's kind of the nature of the PA is you are reporting under, you're working under a physician, and it's just easier for them to have the physician certify. So we do have about 10% PAs, but it's a pretty low percentage. Yeah. Well, they are certifying themselves, but they explained it to us that sometimes as a profession that they feel like it's just easier to have the physician go ahead and do it just by the nature of how their clinic operates, or yeah. So also related to HCPs, participation is voluntary. So one of the barriers to the program also is that we really encourage patients to work with their regular doctor so that they can have a holistic treatment plan, but not every doctor is a certifier, and some of them don't want to be. And so sometimes you see folks having to seek out another doctor to certify them for medical cannabis. But we really have a couple of things in here to encourage doctors to go ahead and work with their regular patients. So they're not doing a prescription. That's a misnomer of the program as well. They are certifying the diagnosis. So they are saying, I've had a physical exam with this patient, I've reviewed their medical records, and yes, I agree that they have this diagnosis, and the diagnosis is one of our qualifying medical conditions. They also agree to provide ongoing treatment. And so that's where we're really trying to encourage people to their regular doctor to certify them. And then just also we require that the HCP would provide access to their health records if MDH were to request them, if there were a serious adverse health event or something that we need to follow up on. They also need to recertify patients annually. So that initial certification has to be in person, but now in recent years we've allowed for the recertifications to be done through telehealth, which I think has really helped patients. COVID has really stretched our imagination for what healthcare can look like, and I think that there's been some positive changes in our program and elsewhere related to that. So then the last group we're going to talk about are registered caregivers. So a caregiver needs to be invited by the patient to be their caregiver, and then they have a separate application and registration with the Department of Health. So the patient will put in the name of the caregiver that they want, and they will be sent a link to register with our program. To register, they have to have a background check. They have to be 18 or older, and they can also be a patient and a caregiver in our program. They can be both. And they agree to have this background check done every 2 years. And what being a caregiver means is that they can pick up product on behalf of a patient, and they can also help administer that product. And they have protections under the law to be in possession of the product. So now we're going to talk a little bit about the medical cannabis manufacturers. Like I said, we have 2 in Minnesota, Vireo Health and Leafline Labs. Each of the manufacturers is limited to one cultivation and processing location. So all of the growing and the making of those extracted products is done at one location for each of those. And then each of the manufacturers can have up to 8 cannabis patient centers or dispensaries. At each of the distribution locations, like we've already said, there needs to be a Minnesota licensed pharmacist who's responsible for dispensing the medication to the patients that are enrolled. And that pharmacist has to do a consultation with the patient and recommend a formulation. And this is true anytime they change dosage or change product. They have to have a new consultation. If they're doing what we would call a straight refill, they do not have to meet with the pharmacist again. They can just come in and pick up their product. There's also a maximum 90-day supply. That is a very squishy definition that the legislature passed. We actually get quite a few inquiries from law enforcement about what is a 90-day supply, what can people be in possession of, and we do a lot of education there about, just like every medication, it's going to be different depending on the condition, depending on the individual. A 90-day supply is going to look different. And then we don't allow consumption of medical cannabis on site, so there's no sampling of products or anything. Where are these dispensaries? So far, we can have up to 16 in the state, and we're at 13 now, and there are plans to add 3 additional. There's going to be one opening up in Mankato, I think within the next month or so, and then the other 2 locations are still sort of under planning. And then what kind of products do we offer? So the 2 manufacturers are private businesses. I think that a lot of folks assume that the state health department sets what the products are and sets what the price is, and we do not. Those are private businesses. They set their own product line. We have established the kind of the category or delivery method, so capsules, but it's up to them to determine what do those capsules look like, what are the different dosages, and product line that they're going to offer for patients. So both Leafline and Green Goods are offering slightly different product selections. But generally, it's the difference in the products is that it's really characterized by the ratio of THC to CBD. So you'll have some products that are high CBD, low THC, some that are a 1-to-1 ratio, and some that are low CBD, high THC. And again, those are offered that way because it really depends on what condition you have, what's going to be effective for you, how your personal body responds to the cannabis. And so we want to offer a really robust range of products for patients. And then, like we said, we have packaging and labeling requirements as well. So here's just a sampling of these are the non-flower products, some of the non-flower products for Green Goods, and you can see that it's got the label on it. It looks like medicine. It should be fairly obvious to law enforcement or anyone else that's questioning what the products are that it is a medication. And then similarly, these are the new flower products, and so the jars are the loose flower, and then the other container is pre-roll. Similarly, there's a sampling of Leafline's products. So you can see that they look a little bit different, but generally it's capsules, it's oral solution, they're very similar. And then these are the Leafline products as far as flour, loose flour, and pre-rolls. So we're going to talk a little bit about program statistics, but not go too deep because you're going to go a little bit deeper when David speaks. So patients active in the registry, when our program was started, we really were expecting, I think they built everything from staffing and budget and tools that they gave us as far as software to manage the program around expecting about 10,000 to 15,000 patients maximum. You'll see that this is the end of the 4th quarter of the year, and we were at about 29,000 patients. We added flower on March 1st. February 1st is really when we started allowing, we knew that there was some kind of pent-up demand for flower, and so we did let the manufacturers start doing pre-consults. So people could come in starting February 1st and meet with a pharmacist and talk about flower and kind of complete that consultation piece so that they could be ready to actually pick up product on March 1st. So we tried to eliminate some of the anticipated bottleneck there. And this is what we saw from February to March. We're now at 32,000 patients just from December to March. And so we've seen a sharp increase. Our call center has been very busy. We've added an additional, we brought on some temporary agents to answer phone calls and process applications. As of yesterday, we're processing, back to processing applications in 48 hours, which is fantastic. We were at one point, it was taking us about 5 days to process those applications, and we're back to 48 hours, which is sort of our sweet spot and where we like to be. Similar trajectory for healthcare practitioners. When we first started in 2015, there was a lot of hesitancy from medical providers about what's it mean to be a certifier? Is there stigma around that? You know, we had physicians that would not use their clinic email address to be a certifier in our program. They would use their Gmail address. We've largely gotten over that. We did a significant amount over the years of pre-COVID of like grand rounds and CME events and getting out to healthcare systems and really talking to healthcare providers about what is this program, what will your patients experience if they are in the program, what do we know, what data do we have, and people have been really receptive to that, and you can see that the stigma is kind of slipping away, and we just continue to see more and more healthcare practitioners being open to being certifiers in the program. So product sales. This is just a look at, so pre-March 1st, where we were at with weekly sales on extracted products, and then where we are at now in March with the blue bar is extracted products and the green bar is dried flower. And I guess what this demonstrates is that there's still demand for both, right? So, and like other medications, we see a lot of patients will use a variety of products. And so in the instance of like pain, someone might take capsules for an extended relief of pain, but they might also get a vape, or they might get dried flower now in case they have breakthrough pain, and then they can use a little bit more and they can titrate their dose a little bit themselves. So when I talk about us having a commitment to research and contributing to the literature, we do comprehensive reports. Every time we add a new condition, we try to look at that patient experience in the program with that particular condition. And this is one of the reports that I like to highlight because I just think it was so impressive. So 7 out of 10 patients said they had tremendous therapeutic benefit from using medical cannabis for PTSD. And when we reviewed, we did leave like an open comment box on this particular survey. And when we reviewed the data, the comments were so rich. Like normally as a state agency, you do a report, you pull out a few quotes to put in the margins, and we could not pull out a few quotes. Like there were so many moving comments from patients that we put them all in the appendices because we just couldn't select. And there's a lot of skepticism from providers in the mental health community in particular around using cannabis. And, it's one of the tools in the toolbox. I understand their hesitancy and the lack of data, because obviously folks that are in that profession are very data driven. And, but we want to also be able to present what we also think is very valid data. This is patient experience data. And, well, the things that we heard from PTSD patients were things like, I've slept through the night for the first time in 10 years. And if anyone has had trouble sleeping, you know that sleep can help with a whole lot of things. And people were able to say that, that it calmed their symptoms enough that they were able to go back to therapy, which is what the mental health providers want them to do. That's frontline therapy, that's frontline treatment, is getting into therapy for PTSD. And if this can help them get there, I think that's absolutely fantastic. Another opportunity that we've seen is that we are able to partner with researchers, and you'll hear a little bit more about that, but this is just one example. We have an oncologist at Park Nicollet that we partner with regularly. We hear a lot from oncologists. I heard from one from Mayo Clinic who said he can't think of another drug that's come on the market that he has been able to say has been this life-changing for patients as medical cannabis. And so it's comments like that that really keep us going. This is a program that's under a lot of scrutiny. It's very political, but it's those patient comments and those healthcare provider comments that really make it worth coming into the office every day. And then lastly, we try to do a lot of education. So we provide, I think some of the brochures are even downstairs. We have on our website where folks can come and request all kinds of brochures for patients, how do you enroll in the process, for caregivers, for healthcare practitioners. We try to do infographics and make it really easy for people to understand the process. There are a lot of steps, but we try to really break it down and make it easy for people. They can also always call our office. And then we do have brochures for law enforcement because we want them to be knowledgeable and not harass patients and not, that patients do have protections under our program. So we try to be in communication with law enforcement as well on any changes that we have to the program. And that's all that I have for formal presentation. You're going to get the slides, I understand, so I did put in a link to speaker requests because, like I said, we do a lot of education. We do a lot of conference presentations, but lots of medical systems. And this year we're making an explicit effort to really get out into community-based programs and do some education. So we've really kind of hit all the major clinic systems in the state, but we really want to get out to some of those, like the federally qualified healthcare clinics and community-based clinics, and let them know about our program as well. So, any questions?